is associated with better outcomes than the use of any single one of those treatment options alone. Therefore, survival of our patients with mesothelioma is beginning to improve. Up to 80% of cases of mesothelioma are associated with asbestos exposure. The remaining cases can be related to family contact as well as non-asbestos type causes. People most often are diagnosed with mesothelioma in their 50s to 70s, and males are affected more often than females. It can be difficult to differentiate a malignant pleural mesothelioma from a different type of cancer that we call metastatic adenocarcinoma. These are two completely different types of cancer with vastly different treatment options. As I mentioned before, pleural tumors are more frequently metastatic cancers than mesothelioma, and so we utilize many different tests to accurately make that distinction. It is crucial that we have enough tissue sample or a large enough biopsy specimen to adequately characterize not only the tumor as a mesothelioma, but also to distinguish which subtype of mesothelioma we have. In specific, epithelioid, sarcomatoid, or mixed. Epithelioid mesothelioma is the more favorable subtype of mesothelioma and carries a greater chance of survival after surgical and multimodality therapy. Sarcomatoid mesothelioma is composed of spindle-shaped cells, and these tumors tend to have a less favorable outcome. Part of the difficulty in making a diagnosis of mesothelioma are the subtle symptoms that a patient exhibits. Dyspnea, or difficulty with breathing, is the most common symptom, and that is usually due to the presence of a pleural effusion, characterized in blue. This accumulates in the spaces between the visceral pleura and the parietal pleura, in between the lung and the chest wall. Chest pain can also be common. Other symptoms include cough, loss of appetite, weight loss, night sweats, and even hemoptysis, or spitting up blood. On physical exam, there may be decreased breath sounds on the affected side. There can also be a mass in the chest wall, and this could be painful. There are a number of radiologic tests that we order while trying to establish the diagnosis. The stage, which tells us how advanced the cancer may be, and determine if surgery is feasible and in the best interest of the patient. CT scans of the chest are usually one of the first tests that we order. It is readily available and it provides some very useful data. PET scans help determine if there's any suggestion of disease in the other lung, in the abdomen, or in other areas of the body. At times, MRI can suggest invasion into the chest wall, mediastinum, or across the diaphragm into the abdomen. This usually indicates that surgery would not be an option that would benefit the patient. All the information we gather, including CT, MRI, PET, as well as histology from the tissue biopsy, is used to gain a better idea of the anatomy of one's mesothelioma